Okay, welcome everyone joining today's important topic, suicide prevention and crisis hotline. And actually September, it's Suicide Awareness Month, and it's also Minority Mental Health Month. So we bring to you this very important topic, and today we have a very prestigious speaker, Dr. John Montgomery. Correct me if it's wrong. And it's a very important topic, and we have the expert to talk about this. I want to introduce to you very briefly about Dr. Montgomery. Dr. John Montgomery, MD, MHA, it's a senior medical advisor in SAMHSA, and currently serving as the acting director of the 988 and Behavioral Health Crisis Coordination Office. Prior to his arrival at SAMHSA, Dr. Montgomery was the division chief for behavioral health care at Arlington County, Virginia, Department of Health and Human Service. Dr. Montgomery is a licensed physician in Commonwealth of Virginia, and it's a board certified in adult psychiatry. He graduated from Brown University Medical School and completed his adult psychiatry residency at Massachusetts General Hospital. So all these brilliant names can guarantee a very productive and very informative section. So with that said, I will give the stage to Dr. John Montgomery, and thank you for giving us this very important talk.
Thank you for the invitation. I'm honored to be here and happy to talk with you about 988, particularly in the context of suicide prevention Awareness Month, as you mentioned earlier. So again, I'm John Palmieri. I'm with the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is part of the U.S. Department of Health and Human Services.
各位大家好，这一位是Dr. Palmieri，他是一位医生，他是从美国substance use 跟那个就是药物使用，还有心理健康服务处是美国那个卫生服务部所属。Thank you.
So before speaking about 988 specifically, I just wanted, excuse me, to emphasize why 988 is so important.
在开始讲座之前呢，他想要大约的解释一下为什么988是非常的重要。
We know in this country that there are many people who have mental health and substance use needs who are not able to get the care that they need.
在美国有很多需要关注、需要照顾的这些大众，但是经常没有足够的资源来帮助他们。
And as a result of those gaps in care, we know that there are many people who find themselves in crisis situations, and that suicides and deaths from overdose remain, unfortunately, very common in this country.
因为缺乏这些资源呢，所以会发生有自杀或者是心理健康或是药物使用危机。所以这其实是美国一个政府蛮关心的大众卫生问题。
So we see 988 as this opportunity for those individuals who have mental health or substance needs to be connected to care any time of day or night, wherever they are.
大众心理卫生问题其实是一个24小时全天性的一个问题。
So our goals from the federal perspective are to make sure that we're creating a network of 988 centers that can answer the volume of contacts when people are in crisis, and then also making sure that we are building a broader system of crisis services so that even after the 988 contact, people are connected to the care that they need.
这个988其实不光是一个单项的服务，它是一套系统。那在帮你连接了以后，更重要的是能够再帮你连接到相关的这些之后的为你提供这些一系列所需要的服务，所以不光是只是帮你接通这个电话而已。
So this is just a little bit of history about 988 and the National Suicide Prevention Lifeline.
好，接下来的话呢是给你简介一下这个国家预防自杀生命线的这个里程碑。
The National Suicide Prevention Lifeline has been in existence since 2005, and over the past 17 years has continued to grow and develop with expansions in capacity to serve those in crisis.
这个国家预防自杀生命线是从2005年就已经开始，如今已经有17年的过程，一直在不断的增加它服务的品质以及扩展它服务的范围。
When the service started in 2005, the only way to access it was through calls, through an 800 number. And then over the years, that access has expanded so people can now access the Lifeline through calls and also chat and text.
从2005年开始的时候，唯一的沟通的方式是打电话。不过在经过这一系列的扩张，现在是上网或者是用短讯也都可以得到相关的资讯以及服务。
And then in the past couple of years, there's been activity at the federal level to create this 3-digit number 988, which is now the easier to remember way to access this lifeline.
在联邦政府的努力下，我们现在把一个比较难记的800的号码改成3位数字，所以会有今天的988，是方便使用者容易能够记忆，然后更容易的去使用。
So even though the 800 number still exists, we think that over time, because 988 is so much easier to remember, that people will rely on that more heavily through call or through text when they're in crisis to be connected to a counselor.
原先可以打通的那个电话号码800的电话号码，现在还是可以使用。但是基于988是更好记忆，而且更容易使大众使用。那我们想接下来呢，988可能会取代使用方面的广泛性会取代原来的电话号码。
The ultimate goal here really is to make access easier, to reduce barriers, so that those people who need the care can get the care easily without having to remember a complex number.
这个988的产生是完全是取之于让使用者能够更方便，更准确的能够记得，能够通过电话或者是聊天或发短讯得到资源，能够帮助他们的情况。
So basically, this slide speaks a little bit in detail about how the Lifeline currently works. The Lifeline is a national network of about 200 centers that are located throughout the country that respond to people in crisis.
所以你看到这个图，它是一个简介，说这全国有大概200个那个电话中心可以帮你接通这988生命线的服务。
When people call 988 and to speak to somebody at the Lifeline, that call, whether it's through a cell phone or a landline, is connected to the crisis center that's closest to the person based upon the area code they're calling from.
当你打988，你是被连线到离你电话那个区域号码最近的那个中心。
And if that local center is busy or isn't able to answer the call, then the call then gets directed to a national backup center to make sure that there's somebody available to answer the call.
如果为你服务的那个中心现在正在有那个占线，那你的电话这个988的这一通打进去的就会被转到那个一个父辈的全国性的一个backup 那个中心来帮你回答，就是不会有间断。
And then for text and chat, those contacts currently are sent directly to centers, a smaller number of centers at the national level that respond to text and chat, though we are also moving in the direction of sending those to local centers because we want ultimately for people to be connected to the local community supports to provide ongoing treatment and recovery need supports for those people.
Okay. 现在今天你如果是发短讯或者是在网上用那个聊天式的那种发信方式，它现在是转到一个全国性的服务中心，但是呢接下来我们是希望能够把它转为地区性，能够更直接的、更简便的为你提供所需要的服务。
And the last thing on the slide is just the volume. So you can see here that in fiscal year 21, the Lifeline as a whole received about 3.6 million contacts. And we expect that with 988 and with it being easier to use the system, that number will continue to increase.
在2021年生命线收到了大约360万次的联系，这包括电话、聊天或者是发短讯。
I want to emphasize here that there have been a lot of studies looking at the effectiveness of the Lifeline over the years since it's been in place since 2005.
对于这个生命线的使用，有相当多全国性的这种研究来了解它的成功率。
And those studies have shown, speaking with people following interactions that they've had with crisis counselors, that they feel less depressed, less suicidal, less overwhelmed, and more hopeful.
经过这些研究，他们发现，打电话的使用者跟跟他们咨询的这些顾问谈话以后，大部分的人是比较没有那么忧郁，比较没有那么有自杀倾向，不会觉得生活太多的那个压力，然后希望那个也比较有对未来也比较有期望。
These next few slides, I'm not going to spend a lot of detail on, but they're intended to show you how the federal government has supported the implementation of 988 over the past year.
这些只是一个给你一个参考的资料，它不会讲得很详细。不过这些就是在过去政府所花费的这些时间、精力还有金钱，在建设988以及他们所做过的努力。
The main thing that I'll just emphasize here is that as of about a year ago, there were limited federal resources that were dedicated to support the Lifeline. And in the past year, those resources have increased significantly.
之前在2021年1月的时候，我们有相当多的那个联邦的资金有进入参加这988生命线的这个 project， 很庆幸的跟您说，这个政府所花费的只有增加，还有更多的资源是往这方面使用。
So we have used our federal role, and again, these next couple of slides, I'm not going to go into all the detail, but just to say that we've used our federal role at SAMHSA to focus on a few critical areas that we think are very important to support 988 implementation.
这些只是给你继续的做一些参考的资料它不会详细的解释。不过呢，在他所工作的这个卫生服务署这个部门呢，有讲解，有很多的资讯是专门注重于988生命线的相关的一些开发以及使用。
So on this slide, a couple examples of that, which are many more resources in terms of financial investments from the administration and supporting 988, making sure that we're bringing people together to learn about best practices to support 988, and then also very much focused on building up the capacity of the center so that they have the workers, the crisis workers who can answer these calls, chats, and texts.
当今的政府是非常注重988以及这个988它的实用性。那这些现在所付诸实行的988这一切的措施法规都是基于我们对于做临床实验了解到的最好的使用方式。而且也是不断的在增加它服务的范围以及它的成效。
And then two other areas that we've been focused on are communications to make sure that there's increasing awareness about the availability of this service to the public. And then also thinking about how the crisis centers fit into that broader continuum of services so that following a crisis, again, people are connected to ongoing support so that they're not just repeatedly cycling in and out of crisis situations.
接下来这一章有介绍2个重点，第一个是宣传跟大众的这个熟悉度。那988是希望能够变成家喻户晓、耳熟能详。另外一个呢，就是要不只是接你的电话，然后给你一个答案，而是说帮你接了你的电话的时候，能够帮你接洽到服务单位，让你能够有一系列一条龙的服务措施，而不是让你不停的回来打这个电话，只是解决短暂局部性的问题。
And I'm just going to highlight a few specific examples from these 4 areas in these upcoming slides. Oh, sorry, go ahead.
sorry，他接下来他有4个部分，他想要分别的为你做一些比较详细的解释。
So this first one here is just a bar chart, basically to make the same point that historically there have been challenges with funding of the Lifeline, and you can see in fiscal year 22 that there has been a significant increase in the amount of funding to support the Lifeline and to support 988.
OK， 你可以看得到，从2007年到今年，这个政府所使用的资金在这方面是逐年增长，从2007年的290万到今年的432万，不对，8千万，4亿4200万，对，18倍的差距。
And then here, one of the things that I didn't mention is that because there have been resource challenges with the Lifeline historically, the network has struggled with answering all of the volume that's been coming into the system and answering it quickly.
我可以翻译这边，就大概说，因为历史上这个资金的不足，还有资源的不足，过去呢这些对这个防自杀跟心理健康热线的这个回复是比较差的。
So one of the things that's been a positive development with the increased funding over this past year is that response rates have improved significantly, and the wait times have gone down significantly when people are calling into the system.
有了这些新注入的资源呢，我们可以看到这个对回复这个电话或者是回复这个需求的回复率得到了大幅度的提高，而且这个用户的需要等待的时间大幅度的缩短了。
So a lot of statistics on this page, but the bottom, I mean, the most important message is that more people are getting helped, and they're getting helped more quickly.
这张页面上有很多统计数据，但主要的重要的观点是，你可以看到，因为这些资源的注入，更多的人在得到帮助，而且得到更快的帮助。
I also just want to pause here for a minute to talk a little bit about 988 and 911 because they're often compared when people are talking about these systems.
这里呢，我们想讨论一下911跟988的区别，因为他们经常会被拿在一起做比较。
One of the primary goals of 988 is to actually decrease activation of 911 because we want people who are in a mental health or substance use crisis to be connected to somebody who has the training to support them.
一个988的主要功能是我们想通过它来降低人们需要打911的这个需求，因为我们可以给这些受到困扰的人更快的帮助，这样就避免了他们需要去拨通911，然后去得到那方面的救助的需求。
And we know in these situations that when 911 is called, often what happens is that people are taken to emergency departments where they might stay for a long time, or law enforcement is called to try to respond to the crisis situation. And those are outcomes that we are trying to decrease by linking people to 988.
我们想通过把人们需要得到救助的人连接到988呢，这样的话我们就可以降低这些人产生那种负面的后果，需要把那个警方或者是直接的医疗救助拉进来的这样的情况。
And so in order to be able to meet those goals, we do need to collaborate with the 911 partners to make sure that we know which calls belong where. So, and that we're always trying to look for opportunities to divert people away from 911 and toward the 988 system.
为了达到这个目的呢，我们跟911的这个电话中心是有密切的合作。我们想办法能够让那些不需要通过911的这样的电话可以转到988来，然后我们可以给他们提供相关的服务。这样的话就降低了他们需要打911的这样的需求。
So just briefly here, wanted to show how the crisis centers connect to the rest of the crisis continuum.
这一张这个页面是显示我们怎么样把这个988的电话连接到后续的服务中去，因为像之前的slide 已经讲过，就是988不单是一个电话，它可以帮你连接到后续的相关的服务中，然后可以让这个打电话的人得到及时的救助。
So we think here that it's important not only to build the workforce and the capacity in the 988 centers, but also to make sure that we have mobile crisis units that can go out to provide support for people in their communities, and that there are facilities that can provide support and stabilization outside of hospital emergency departments for people to get ongoing care.
所以呢，我们是不光是增加这个988这个电话中心的服务的这个容量，同时呢，也是增加后续服务的这个容量，包括了比如说会有一些小的行动部队，他们可以很快的为这个打电话的人提供服务，在当地，或者呢是如果是需要救助的话，可以把这样的受到困扰的人送到当地的这种相关的小的诊所，可以得到及时的救助。
And we know that this is going to take time. We've set goals here over the next 5 years, but we think it's very important to continue to build out these services as we're moving along. So again, people have the connections and the support that they need.
这个需要接下来几年我们不断的增加这个容量，然后我们可以把大家的所有的资源都拉进来，不断的提高我们的这个服务的容量。
And then in order to be able to create that system, we know that there are some areas that we need to be very focused in on to support those goals. And so here is just a list of the things that we think are going to be areas that we need to be very focused in on to build out that crisis system.
为了达成这个目标呢，这里我们就是列了几个我们需要关注的方面，来帮助我们提高我们的这种服务。
Here we need to continue to demonstrate federal leadership to support crisis services. We need to make sure that there's equity in access and outcomes. We want to make sure we're using data to support how we're measuring services. And then we want to make sure that we are building workforce, sustaining workforce, and finding ways to continue to finance the system.
这里呢，第一个就是联邦的整合力，我们运用联邦的资源，把大家调动起来，一起来提供这种服务。第二个呢，就是我们要关注的就是公平性，让所有的族群都能得到同等的对待跟服务。第三个呢，就是我们也运用这些数据来不断的评估我们的这个服务，然后运用新的技术来改进我们的服务。第四个呢，就是我们要增强这方面的就服务的人的数量，然后让更多的人可以加入到这个服务中来。当然第五个最后就是需要有资金的资助，来不断的引入新的资金来提高这个服务。
And then kind of underneath all of those is the importance of communications again, and making sure that we continue to increase awareness of the life-saving services that are available through 988.
这个呢，我们就需要不断的提高我们的沟通管道，让这个在基层 在这个社区的这个人群能够得到新的关于988这方面的讯息。
And so one of the ways that we are increasing awareness of 988 is that we have developed a web page on the SAMHSA site.
一个很重要的方面呢，就是在我们这个药品滥用与心理健康服务管理局这个我们有一个网页，我们把所有跟988相关的资源都放在这个网页里面，给大家提供参考。
So at samhsa.gov/988, you can find a lot of information about the Lifeline and about 988. And within that site are a number of materials for the public and anybody to use to learn more about the system and to also promote awareness in your communities.
这个网页呢有各种各样的跟988有关的资源，这个是完全免费的，大家都可以去用，然后也可以帮忙宣传这个988的资源，让更多的人知道这些资源。
And here are just some examples of some of the materials that you can find on the website. This actually was as of April, but it's been updated since then. But these are just a list of things, fact sheets, messages, printable materials that anybody can use. This is for everybody's use to be able to increase awareness about 988.
这里呢列举了几个这方面资源的例子，比如说像这个简要，比如说像一些重要的讯息的宣布，还有这个常见问题的回答，还有一些这个他们相关的报道，还有他们的这个他们的标志，988的标志，以及这个我们今天得到的这个讲座的这些都是公共讯息，大家都可以免费的去获取。
One of the other things that we've done on our webpage in an effort to support the workforce needs is to make sure that we are listing all of the centers and potential job opportunities, volunteer opportunities that exist within all the centers to support the 988 network.
另一个重要有关的讯息就是关于人力资源，因为它需要引入很多人力资源，在这个SAMHSA 的这个网页上也有这一个网页专门讲怎么样引入更多的人力资源，或者是工作，或者是以志愿者的形式来加入到这个服务中来。
And then one of the other things that is underway is some additional communications work that's very much focused on populations that we know to be at higher risk of suicide, because we want to make sure that we're developing communications plans that are going to reach those particular high-risk populations.
一个我们下面的重点就是我们要让我们的沟通更加有针对性的，针对那些有一些族群，他们的自杀率比较高，他们就面临这种精神压力，还有这个心理健康的困扰的问题的情况比较严重。我们下面就是要针对他们进行一定的沟通方法。
I saw a couple of questions in the chat, so I'm just going to respond to them if that's okay.
Sure. 下面我们就是要sorry, I just translate that part.
Okay.
就是这个 Dr. Montgomery 他看见了，就是我们的 chat 里面有几个问题，他想现在借这个机会先回答一下这两个问题。Go ahead, sir.
So the centers have access to interpreter services in about 240 languages. So if somebody is in crisis and speaks a language other than English or Spanish, they have access to interpreter services through the centers.
这个电话中心是有这个翻译的服务，大概有240种语言的这个现场翻译服务，这个可以在接入电话的时候一并提供。
And then if somebody is interested in either volunteering or working for one of the Lifeline centers, you can go to the page that I just had up here. and then look at the particular center that you might be interested in or the location, and that will take you directly to their volunteer or hiring page, and many of them allow remote work options.
So just I want to follow up that the job, are you referring to translation or?
No, sorry, for crisis workers, people who answer the calls through 988.
如果大家有关对于加入这个人力资源，有兴趣的话，可以到这个网页上看看有哪些工作是适合你的，然后有哪些这个电话中心是在你的住家附近，你可以去参与，或者是其实有很多这些工作机会是提供这个远程工作的机会，大家可以在不同的地方就可以加入这些电话中心，然后可以获取这方面的工作机会。
And then I'm just going to go, this is just the last slide, and then happy to answer additional questions, and I'll take a look through the chat as well to see if I've missed anything. But this is just a final slide to basically encourage you to look at the materials we have on our website, to certainly spread awareness in your own communities around 988 and the services that are available to people in crisis, and then always to send feedback to us on ways that we can improve the system. I will throw my email in the chat here as well, so you can always feel free to reach out to me directly.
最后这一页就是大概一个总结，就主要的目的就是让大家能够有一个共同的语言，来运用这个988，然后呢可以把这个消息传达出去，让更多的人知道这个988的这项服务。然后呢，就是如果有任何的这个反馈的意见，可以也反馈给988的这个服务中心。包括Dr. Montgomery 在这里，他会把他的联系方式发在这里。如果有任何反馈意见，也可以直接送给他。
And one of the other questions was about volunteering as an interpreter, and I don't have the contact information for the organization that does the interpretation, but I can get that information to provide that for you.
Dr. Montgomery 说他现在没有直接的这个联系方式，但是他会找到这个联系方式，关于这个参加翻译的这个志愿者或者是工作，他会把这个消息分享给大家。
And so, yeah, so that is basically my last slide. I'm happy to answer any questions. And again, very much appreciate the opportunity to talk with you this afternoon about 988.
So there's a question about is the call 24 hours service? Can the caller speak Chinese?
The call is the service is 24/7 round the clock. So there's no stoppage in service. And if somebody is calling into the system and speaks Chinese, then the center, if the center does not happen to have a staff member who speaks Chinese, they would utilize the interpreter service that they have access to be able to communicate with that caller.
首先呢，这个电话是1天24小时，1周7天，全天候的，都可以接电话，都可以打电话。再一个呢，就是如果你打进来是中文的话，这个因为它这个像前面已经讲过了，这个电话会被接到一个当地的，根据你这个电话的区域号码会接到一个当地的服务中心。如果当地的这个服务中心没有中文的服务的话，他们可以把它转到他们可以连接到一个在线的翻译服务，把它引进来做现场的翻译。
Thank you so much. And actually, I have one question in mind. Is that what kind of the appropriate situation for someone to call in 988? I mentioned earlier I was actually a volunteer for the hotline, and someone actually just needs someone to talk to, not necessarily having a crisis. Would that be okay? Maybe some depression, middle of the night.
Yeah, so I mean, anybody can call into the system or text into the system or chat through 988lifeline.org. So, I mean, it's intended to be a crisis lifeline, but anybody can call if they're having any form of distress or need someone to talk to. And then one of the goals of the office or the center is to connect that person with ongoing support so that they have that connection that they need. But anybody can call really for any reason, where the centers will not turn somebody down like for a particular reason, like anybody can call.
Yeah. 我可以讲一下哈，就是刚才的问题，就是可能很多社区人士会觉得我的情况到底够不够严重，该不该打这个电话？那如果你有这个需要，可能都可以就打一下988，看一看，让接电话的人衡量一下这个情况。
大概就是任何人其实都可以打进这个电话，只要你不确定你有这方面的需求，你认为你需要有一通这样的电话，可以让别人帮你确定一下，帮你诊断一下，都可以打入这个电话。
Great。所以还有一些时间，如果大家有问题的话，可以在 chat box 里面，或者如果你愿意的话 ，unmute yourself or turn your camera on and ask your question. If not, we have a great information session today, and we certainly will bring the information back to the community and encourage people in crisis to use the hotline.
Hi, this is Michelle Tai. I have a question for actually Dr. Palmieri, and maybe this is going to be beneficial for the group. I'm looking at the fact sheets, and I only saw in English and Spanish. Is there a plan to have that translated into different languages?
Yeah, so I mean, our plan is always to increase language access. So the centers do currently use a language service to provide translation for other languages. I think about 240 languages outside of English and Spanish. But there's always work underway to try to increase kind of staffing within the centers themselves to provide that language access. That just becomes a bit of a sort of a workforce challenge as we're trying to kind of recruit for the centers. But people who are speaking any of those 240 languages will get access to services. It's just that the center will use an organization that provides interpreter services for that organization.
让我翻译一下这个提的问题是，如果现在的这些宣传海报或者是这些资料只有西班牙文或是英文，那将来会有其他更多的语言可以来简介吗？那答案是的，没错的。我们现在因为正在陆陆续续的翻译全部一共大概240个不同种族语言。那这当然是需要一定的时间才能够完成的。不过你如果需要打988的话，它那个翻译的这个服务是绝对在线，所以你不需要担心说怕语言沟通有问题直接打988，它会帮你跟会讲中文的这个翻译叫线，然后帮你做这个服务。谢谢。
Okay, I think we answer all the question, and we so appreciate having this opportunity to hear about this and get to know more about the resource out there. And again, we will help the 988 promote this line and refer people to the line if it's appropriate. Today, we are so appreciate Dr. Premier's presentation, and also thank you to Officer Dr. Chi and Daniel's help with the translation. You did a great job, and the information goes very smoothly. Thank you so much.
Thank you all so much.
好，感谢大家今天参加今天的讲座，这个是很重要的一个信息人什么时候碰到什么重要的事情都很难说得定，但是永远知道现在有一个988很简单易记的一个号码，有需要的话就可以拨打这个号码，帮你连接到本地甚至是更大范围的一个资源的网络，我们大家一起可以把这个社区建得更健康，更就是大家更健康和更开心。好，感谢今天大家来参与。如果你是来的比较晚的话，我们会把今天的录影放到我们泛亚门诊的这个 YouTube channel 上面，你们可以随时回来再看。好，感谢大家 ，Thank you so much。
好，谢谢，
Thank you。
再见。
Thank you. Bye bye.
Bye。